a little bit about myself. I'm here. Thank you, INASP, for inviting me here. I'm a long-time fan of INASP. They've been very helpful for me in my job. A little bit about myself. I've spent the last couple of decades working in international development, primarily for the NGO sector. And I've spent a lot of time living and working in the Philippines, in Sri Lanka, in the Maldives, and about 12 years with VSO, Voluntary Service Overseas, if any of you know that. About 4.5 years ago, I found myself working at the University of Leeds as the Research Communications and Uptake Manager for a health consortium, a health consortium called Commodus HSD, Communicable Diseases Health Service Delivery. My role is to, I have a gigantic portfolio of overseeing all the journal articles, all the policy briefs, all the research briefs, all the case studies that are produced across 24 projects across several developing countries that we work in. And my role, more and more, has been to make sure that these findings, these research findings, are made available for free. And they have to be made available for free because part of our remit is to help progress the Sustainable Development Goals as best we can. And so we are based in some of these countries. So that's us in the UK. We are 100% funded by DFID, Department for International Development. DFID has a funder mandate on open access, which came into being in the middle of our contract. So then we had to go through quite a learning curve to make sure that we were fulfilling our obligations. Our other partners, the Centre for Global Health Research in Ghana, we used to work with them until very recently. We spent several years working with them. We've got Good Shepherd Hospital down there in Swaziland, a rural clinic. We've been working with them for years as well. We're very lucky to work with the Malaria Consortium in several countries. Currently, we're working with them in Ethiopia and in Myanmar. We used to work with them in Uganda and Zambia too, so they have a very good reach. We work with the Association of Social Development in Pakistan. We work with HERD in Nepal, and we work with ARC Foundation in Bangladesh. And lastly, we worked for many years with China, but we've gone into an extension period where China is no longer part of our consortium. So that's where we are. So how do I do this now? Right, hands everywhere. We lead a consortium of NGOs, but I am based at the University of Leeds. So that brings with it all sorts of challenges. You will know from your own positions that that researchers at universities have the usual requirements to kind of deposit their research findings in repositories, et cetera, and published in high impact journals. That's not the requirement for NGOs. That's not something that is part of the NGO landscape as much as it is the university landscape, okay? So as someone, when I first came into this role, as someone who had worked primarily in NGOs and not in an academic publishing environment, this was a massive learning curve to try and manage this portfolio, trying to get our research findings out to the real world for free. And so we have encountered some speed bumps. So I'm going to talk you through some of those speed bumps and some challenges. And what I'm going to offer is 4 sets of reflections. So let's start with the first one. We are a multi-country consortium. And multi-country means multi-category for the Human Development Index. Now that means that when you're talking about open access and article processing fees, one size does not fit all, which makes it very, very difficult because there are varying privileges for accessing research findings and the charges for each of the countries, each of our partner countries, for Ghana, for Pakistan, for China, etc. Okay? If we look at the categories, we go by the WHO and the UN categories. Category A or B, someone mentioned I think that it was mentioned, wasn't it, in the question and answer session as well. Countries like Bangladesh, Ghana, Nepal, Swaziland, Ethiopia, they get waivers for everything. That's fine, okay? Not a problem, makes our life easier. Pakistan is what's called a transitional country. It's a category B country. It gets discounts on some things. In other places, it doesn't get a discount. For us, that doesn't reflect the reality. And it doesn't reflect the reality because with our funding cycle, the research happens and the data is analysed, and usually the papers and the findings are written up well after the funding ends. So this is a current situation that we're facing. Our last round of funding finished in December 2016. Our partners in Pakistan are writing up their findings, and they are not in a position to pay for the research, the article processing fees, because that funding has finished. It doesn't matter that they get discounts. It doesn't matter because the money just doesn't exist. So the kind of project cycle doesn't really factor in that writing up happens way down the line, okay? So it doesn't reflect the reality for us. China, as well, is not classed. So China is nowhere on the HDI, which means they have to find their own money to have to pay for article processing fees. And of course, we're based in the UK, which means we basically get an access all areas, golden pass. We've got the keys to Narnia, basically. We can do what we want with it. So it makes it very difficult from a planning point of view to plan in the long term, to kind of budget as well. But it's not just about being kind of multi-category either. There are other kind of speed bumps. And when I spoke to our project officer in Ethiopia, this was the thing. These were the kind of things that they were coming out with. So they said that the major difficulty they face is not being able to get full articles. But then when they Google the subject, which I may want to get, I may get an interesting abstract. When I try to get the whole article, it might require online registration or payment. Basically, what she's saying is there's too much bureaucracy involved. So although Ethiopia gets waivers and gets access through Hinari and portals like that, there is simply too much bureaucracy involved, and the bureaucracy is around proving that they are NGOs. So there are little speed bumps like that we didn't anticipate, that we have to find a workaround, yeah? She spoke a little bit more about Hinari, saying, well, she remembered being given a password for Hinari, but it doesn't use it so much. So to me, that's more about awareness, that these schemes exist, but I don't think they're being actively kind of promoted to those based outside of academic or research institutions. So that's a challenge for us as well. I have to do a lot of kind of groundwork to share these kind of portals with people. Overall, they said that the availability of academic articles for free is very, very important for researchers and for program staff and the academic world, but sometimes you cannot access the articles due to payments or some issues like having to register. Now, on the face of it, it's very easy to think, well, what's the problem? Everyone registers for stuff. You know, when we're shopping online, we register for stuff. When we're signing up mobile phone contracts, we register for stuff. What's the issue? The issue is this is a constant in NGO life, having to prove you are who you say you are and not having the privileges that other people have. So privileges like those based in academic institutions, in formal research institutions, they just have to go through too many hurdles. And that kind of bureaucracy was unanticipated. So it's easy to, I think we've heard a lot about, in prior years, about paywalls are an issue, the actual access is an issue. For us, the bureaucracy is an unanticipated thing, and it's a hidden issue, I think. And also the kind of awareness that NGOs have of the schemes that are available for them to help them access research findings. So that's unanticipated. So the second set of reflections I have is that article processing charges are very, very tricky to allocate. And this is possibly 80% of my role. The money that we spend on open access fees is taken directly from our project funds. And what happens is this eventually takes money away from the resources and the activities that we need to do to progress our work and eventually to progress the Sustainable Development Goals. So for example, do we spend £3,000 on paying the processing charges for a publication, or do we do it, or do we spend it on training doctors in a province in China? In this case, we spent it training the doctors in China. Do we spend £1,500 on designing a leaflet for a health intervention at Good Shepherd Hospital in Swaziland that will lead to people changing their lifestyle decisions to lower diabetes and cardiovascular disease? In this case, we spent it on the leaflet. Do we spend the money on an entire portfolio of publications for Nepal? Sorry, excuse me. An entire suite of publications for Nepal, or do we spend the money on updating the TB material, the guidance that's going to hundreds of clinics in slum areas in Kathmandu, in and around Kathmandu? In this case, we spent it on the material on TB for the Kathmandu region. For us, that was the right decision, but it was a difficult decision. Because don't forget, there's a funder mandate that we are under now, that we have to share our findings using open access mechanisms. And also we have to publish because we are based at a university. And the university says we should publish. So there's that extra challenge there. And so I'm not kidding when I say it was a massive learning curve. It really, really was. So that's the biggest thing there. It's very, very tricky to allocate. Ring fencing is very, very difficult as a result of all of that. It's difficult to predict what the article will be about until we see the research findings, and therefore it's difficult to predict which journal it's going to go to, and will the paper be appropriate for that. So that makes ring fencing very, very difficult. Additionally, the waivers are not guaranteed. I know it's easy for publishers to say, yeah, that's fine. If you fit this category or that category, it's not a problem. But there are issues of bureaucracy that come up to say, well, can you prove that you haven't got funding, actually? Which we didn't expect. We expect to be able to say, this person is clearly from Bangladesh, and not have to go through a back and forth when that happens, yeah? So it's my colleague in Bangladesh is, yeah, so you know what I'm talking about. There's a back and forth. It feels like it's a negotiation, which we never really kind of anticipated. And additionally, there's no real kind of consistency amongst publishers about the nature of discounts. Is it 10%, 20%? Are you part of a scheme, etc.? So we know that it's possible to get a discount, but it just feels like a little bit of a foggy environment for us to try and do that. And then finally, there are extra costs and there are hidden costs. This is the website of a journal that we publish in quite frequently. It is a hybrid journal. It's an example of a hybrid journal. It offers us the option to publish using an open access route. There's the charge there, €1,500. That's fine, except because it's a hybrid journal, we're not going to take that route. We need that €1,500 for our project work, okay? Then there's other stuff here. So there's the excess page charge, should that ever happen. We've only had to do that once, and it cost us €600. We learnt, we have never done that since. That was one of my first challenges, and I made it very clear that was never going to happen again to all the researchers. There's some other charges there. There's the color print, $950. That's kind of hepatitis A and hepatitis B drugs in Pakistan, you know? What do we do? Yeah, we're not going to have a colour diagram. We're going to actually buy the drugs. There's costs for single figures, etc., etc. So it can rack up, okay? It's all very transparent. It's on the website. But when researchers go to submit something, it just adds another layer of anxiety. And what happens is they email me and say, what do I do? I've got a figure. Well, I don't know what to do. I don't know what to say to you. We're going to have to find the money to, like, you know, put a figure in. The interesting one for me is this €100 charge for an online appendix. It's basically moving towards the kind of open data scenario. Now, DFID doesn't, I haven't checked with DFID recently, but I don't think they have an open data mandate just yet. But I know that journals are moving towards open data. PLOS ONE, for example, has open data. Funders are moving towards open data. So if this is the way we're going, at some point we're going to have to factor this €100 charge into our regular publishing costs. Costs that should go towards doing the research and paying the salaries for the oh no, 5 minutes, oh dear. So costs that should go towards research. The third set of findings, the third set of reflections, is that we need to share research findings very quickly, but the embargoes, they limit the amount of impact that we have, and this, to us, is detrimental to achieving the Sustainable Development Goals. At the moment, we've got a couple that are under embargo about mental health issues in tuberculosis patients and how we can scale that up. But policymakers need this kind of information very, very quickly. As soon as we have the findings, they should be able to access them. But for us, the kind of copyright and the sharing rights are restrictive. The question is, why should policymakers have to wait for this? Why should they have to wait for 6 months or 12 months before we're able to share for them? They can't access the research article, don't forget. We can share a Word copy with them, but they can't access it in the same way that others can. When we're talking about entitlement to share, I'm talking about, is it okay to share them in research briefs or policy briefs? Well before they're published in peer-reviewed journals. It's not always clear whether or not we're breaking copyright agreements when we do to that. And it goes back to my prior question, why should policymakers have to wait about research that has a direct impact on their working practices at health centres? We would advocate a kind of standard practice of sharing findings in research and policy briefs before they're being published in journals. So a similar thing. So this is what we produce. So on the left there, we've got interim findings from China. I'm walking. Interim findings from China. You can just make out that we've got some results and we've got some key conclusions. They can act on those conclusions quite quickly without waiting for the paper to be published, okay? If they've got the budget to. Here's some policy recommendations from a brief produced in Swaziland. You'll see there, you can just make out, we're asking them to revisit agreements between the medical stores and the rural clinics. If they read that before waiting for the journal article, then they're able to act on it. These are reasonable recommendations, but copyright means that we might not be able to do that. So it's a bit of a shaky landscape for us. I'm whizzing through this now. I am. The other set of reflections. Please bear with me. Is that for us, we work in a larger environment than just the academic environment. So for us, we think that there are very, very important actors from the global south that do not have adequate access to research findings. So we're talking about civil society organizations, the kind of the networks of people that our partners deal with, journalists who are very, very important. They need to be able to access research findings to hold national agencies to account. Okay, to question what's being said by government ministers, etc. Consultants and external agencies, so for example the national TB agencies that we work with, independent researchers and think tanks. These are specialists in their field who, for whatever reason, are not associated with academic institutions, but they are specialists, and this is who we work with. Government staff are the lifeblood of how we get stuff into policy and practice. They need to be able to access without hitting a paywall. And of course the public. The public are the people who come into our clinics and take part in our interventions, whether it's for cardiovascular disease or TB or malaria, etc. They need to be able to know what's being written for and about them and how it impacts their lives. It's as simple as that. The key thing I want to mention is that none of these types of actors have librarians or libraries to help promote that schemes exist. And this is why it feels like many actors are being on the periphery of the kind of scholarly publishing environment, okay? So what have we learned as a consortium? I've got 1 minute, honestly, last slide. That we have learned that open access has the capacity to help blur the boundaries between academia and publishing, but it's definitely not a level playing field at all. It's still, for us, an exclusive club. If you have an email that is linked to an institution, you have a golden pass that other people do not have. It is very, very, very necessary to progress the role, to progress work against the Sustainable Development Goals. It's very, very important that people are given the power to kind of read what's being written for and about them. I don't have a solution, but I would ask that institutions that have the power to grant access to other actors in the development sector begin doing that. It's as simple as that. Because research is for the public benefit, after all. What we'd like to do is move the debate beyond business models, beyond payment plans, green open access, etc., particularly for developing countries. What I've shared with you is anecdotal, but I've been living it for the last 4.5 years. What we'd like to do also is explore this on a wider scale. We'd want to ask, is what we've experienced typical for other NGOs and other actors in developing countries? And if you're interested, I'm here all day, and I'm willing to talk about anything that I've spoken about the last 23 minutes. Our door is open. Thank you for listening.
Thank you so much.